Hello, this is Dr. Gay from First Look MRI, and this is a 12-year-old male. It's a runner, and they had pain for about 8 months, continued pain on and off, and they come in for an MRI, and we see a single finding, which is over here on the medial side. So this is the medial femoral condyle, lateral femoral condyle. In the medial femoral condyle, we see an area of scalloping and low signal involving the articular surface. And we note that, again, this is the medial side. It is the articular surface, fairly shallow, and it extends right to the edge of the intercondylar notch. So this is the classic location and classic appearance of osteochondritis dissecans. And this entity is seen in young children and adolescents typically. It can also be seen in the mature skeleton as well, but typically see it in younger people like this. Again, it's usually the medial femoral condyle that it goes into the intercondylar notch, so there's a classic location. And our job as radiologists is to decide, is there loosening or displacement, or is it a stable lesion? Here we have a sagittal T1 weighted sequence, and we can see that the margins are well defined, and there's no evidence of loosening or displacement here. On the coronal structure sequence here, there's very little in the way of marrow edema. There's a little bit of bright signal within the OCD itself, but there's no surrounding edema. Again, there's no fluid insinuating. Now, if you see fluid going between the osteochondral defect and the bone, that can be a sign of loosening. And then the next thing is displacement. But again, there's no well-defined band of fluid. There's no displaced bone fragment. So this is a pretty good prognosis, especially in a young person like this. Again, it's very shallow, no loosening, no displacement, no significant perilesional edema. And in the maturing skeleton like this, these usually will heal spontaneously if they don't cause too much repetitive microtrauma. And after the skeleton is already mature, then apparently they don't heal quite as well, and they're more prone to fragmenting and becoming displaced and causing trouble. But again, this is a classic example of a small osteochondral defect compatible with osteochondritis dissecans of the knee. And thank you very much.